Entropion. Introduction. Entropion is an ocular condition characterized by the inward turning of the eyelid, causing the eyelashes and skin to rub against the cornea and conjunctiva. This results in discomfort, irritation, and potential damage to the eye. It commonly affects the lower eyelid and is more prevalent in older adults. If left untreated, entropion can lead to corneal ulcers, infections, and vision impairment. Early diagnosis and proper management are crucial for preventing complications. Definition. According to the American Academy of Ophthalmology, entropion is the inward turning of the eyelid margin, leading to ocular surface irritation and potential corneal damage. According to the World Health Organization, WHO, entropion is an eyelid malposition where the eyelid, particularly the lower lid, turns inward, causing the lashes to rub against the eye. Risk factors. Age, more common in individuals over 60 years. Previous eye surgery or trauma, scarring from surgery or injury can alter eyelid position. Chronic eye infections, infections like trachoma can lead to scarring and cicatricial entropion. Inflammatory conditions, autoimmune diseases such as Stevens-Johnson syndrome can contribute to entropion. Genetic predisposition, family history of eyelid malpositions. Etiology. Congenital entropion. Present at birth due to improper eyelid development. Commonly associated with genetic disorders. Involutional, senile, entropion. Most common type, occurring in older adults due to age-related weakening of eyelid muscles. Caused by degeneration of the lower eyelid retractors and loss of skin elasticity. Cicatricial entropion. Caused by scarring or contraction of the conjunctiva or eyelid skin. Associated with trauma, burns, infections, or autoimmune diseases. Spastic entropion. Due to excessive contraction of the orbicularis oculi muscle. Often secondary to eye irritation, inflammation, or blepharospasm. Pathophysiology. Weakening of eyelid muscles and skin elasticity. Down arrow. Inward rotation of eyelid margin. Down arrow. Constant friction of eyelashes against the cornea and conjunctiva. Down arrow. Ocular surface irritation, redness, and watering. Down arrow. Increased risk of corneal ulceration, infection, and vision impairment. Clinical manifestations. Inward turning of the eyelid, visible malposition. Eye redness and irritation due to constant friction. Foreign body sensation, feeling of something in the eye. Tearing, epiphora, due to corneal irritation. Blurred vision in severe cases. Corneal abrasions or ulcers, if left untreated. Diagnostic evaluation. 1. History taking. Onset and duration of symptoms. Previous eye infections, surgeries, or trauma. Presence of any systemic autoimmune conditions. 2. Physical examination. Eyelid examination, to assess the degree of inversion and severity of corneal involvement. Snapback test, assesses eyelid laxity by pulling the lower eyelid downward and observing its return to position. Slit lamp examination, evaluates corneal damage, conjunctival inflammation, and presence of ulcers. Medical management. 1. Non-surgical management, temporary relief. Lubricating eye drops, artificial tears reduce friction and provide moisture. Ophthalmic ointments, prevent corneal damage and soothe irritation. Taping technique, medical tape can be used to pull the eyelid outward temporarily. Botulinum toxin, Botox, injections, temporarily relax the orbicularis oculi muscle to reduce spastic entropion. 2. Surgical management, definitive treatment. Eyelid tightening surgery, corrects involutional entropion by tightening the lower eyelid and its retractors. Mucous membrane grafting, used for cicatricial entropion to replace scarred tissue. Rotational sutures, help reposition the eyelid margin in mild cases. Nursing management. 1 Risk for corneal damage related to eyelid malposition and constant friction against the cornea. Interventions. Administer lubricating eye drops and ointments to keep the cornea moist and reduce irritation. Educate the patient on the importance of avoiding eye rubbing to prevent further injury. Apply protective eye patches or shields if necessary to minimize corneal exposure. Monitor for signs of corneal damage, such as increased redness, pain, excessive tearing, or vision disturbances. Assist in preparing the patient for surgical correction if recommended by the ophthalmologist. 2 Impaired vision related to corneal irritation and tearing. Interventions. Assess the patient's visual acuity regularly to monitor any changes. Provide artificial tears to reduce dryness and maintain a clear tear film. Instruct the patient to use proper lighting to minimize eye strain and improve vision. Encourage the use of corrective eyewear or protective sunglasses to shield the eyes from environmental irritants. Refer the patient to an ophthalmologist for specialized evaluation and treatment options. 3 Acute pain related to eyelash friction against the cornea and conjunctiva. Interventions. Assess pain levels using a standardized pain scale and document the frequency and severity. Apply cool compresses to reduce inflammation and soothe irritation. Administer prescribed analgesics or anti-inflammatory eye drops as needed. Encourage the patient to rest the eyes frequently and avoid excessive screen time to minimize discomfort. Educate on the use of temporary eyelid taping to relieve irritation until surgical correction is performed. 4 Risk for infection related to continuous eye irritation and potential corneal abrasion. Interventions. Monitor for signs of infection, such as pus discharge, increased redness, swelling, and fever. Educate the patient on proper hand hygiene and eye care to prevent bacterial contamination. Administer antibiotic eye drops or ointments if prescribed to prevent secondary infections. Advise avoiding contact lens use until the condition is resolved. Encourage regular follow-ups with an eye specialist to monitor for complications. 5 Disturbed body image related to visible eyelid deformity and cosmetic concerns. Interventions. Provide emotional support and reassurance regarding treatment options. Educate the patient about the corrective surgical procedures available and expected outcomes. Encourage the use of sunglasses or cosmetic techniques to help with self-esteem until surgery is performed. Offer counseling services or support groups if the patient experiences significant distress. 6 Deficient knowledge related to lack of awareness about the condition and management strategies. Interventions. Educate the patient and caregivers about entropion, its causes, symptoms, and complications. Provide written materials or videos explaining eyelid care, treatment options, and post-surgical expectations. Demonstrate how to apply lubricating drops and ointments correctly. Explain the importance of regular eye check-ups to monitor for disease progression. 7 Risk for injury related to blurred vision and reduced depth perception. Interventions. Instruct the patient to be cautious while walking to avoid falls and accidents. Recommend good indoor lighting to enhance visibility. Encourage the use of corrective eyewear to improve vision clarity. Advise against driving or operating heavy machinery if vision is significantly affected. Prevention. Regular eye examinations, early detection of eyelid laxity can help prevent progression. Proper eye hygiene, avoid rubbing the eyes to prevent irritation and infection. Prompt treatment of eye infections, prevents scarring that could lead to cicatricial entropion. Protective eyewear, shields the eyes from trauma and chemical injuries. Moisturizing eye drops, help maintain ocular surface health, especially in elderly individuals. Avoid excessive sun exposure, UV protection can reduce premature aging of eyelid skin. Complications. Corneal abrasions and ulcers, due to continuous friction from the eyelashes. Infections, keratitis, conjunctivitis, increased risk due to corneal irritation. Vision loss, severe, untreated cases may result in permanent vision impairment. Chronic eye pain and discomfort, persistent irritation affecting quality of life. Cosmetic concerns, social and psychological impact due to noticeable eyelid abnormality. Conclusion. Entropion is a serious eyelid malposition that requires timely intervention to prevent corneal damage and vision loss. While temporary treatments like lubricants and Botox injections provide relief, surgical correction remains the definitive solution. Early diagnosis, patient education, and proper eye care are essential for effective management.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.